I wanted to be a veterinarian for probably since high school. I was either going to be a veterinarian or a sports writer, and I'm glad I picked the field I am because I really like it. I bought this building and I was ready to open my own practice, and I'd been looking for a place and found this building available, and bought it in January of '99 and opened actually 2 months later. As with most practices, we were kind of slow initially, but I had a lot of clients and friends that knew me around here, and so it worked really well. And we've grown, I think, mainly because we really do a good job, and I'm proud of the medicine that we practice here, and we treat our clients well and care about their pets, and so it showed.
Dr. Wunschie just has a very personal touch and takes a lot of time with us, and I don't know that we're very high need, but he takes the time to explain everything that we need explained, and we just feel safe with him with our dogs.
They're just real down to earth. They're not real, you know, do a lot of procedures that don't need to be done. They're just real dependable, great job, make you feel good about your pet, that sort of thing.
How long have you known Dr. Wunschie?
15 or 16 years, I think. For a long time. I had a dog that had a very rare disease, and when I moved from California to here, I actually interviewed vets to find out if they could help with the disease or if they knew anything about it. And Dr. Wunschie and his partner Dr. Jones are the only two vets that actually did research and found out about what was wrong with her and was able to give me options, and kind of they learned from her and then I learned from them, and she was able to live a long life because of that.
This cat has a possible urinary tract infection, and the owner thinks it possibly could have eaten his Aggie class ring. So we're going to run a urinary catheter up him and then take an x-ray to see if the cat has swallowed a ring. This is a client who was an Aggie graduate, and being an Aggie, we're all very proud of our Aggie rings. And he had his Aggie ring on his nightstand and woke up the next morning and it wasn't there. If it had if we took the x-ray and the radiograph showed that it was in the stomach, we could theoretically induce vomiting. We could make the cat throw up to see if it would come up that way. If it didn't do that and it was still in the stomach, we could go in with an endoscope, run an endoscope down it, which is a fiber optic tube that goes down through the mouth, and we have actually a grabber on it. You can find it, send the grabber out, grab the ring, and hopefully pull it up. If it was down in the intestine, then it would be a surgical procedure where we would just go in and open the intestine and remove it, which we do very commonly. Kidney here, see the urinary bladder right there. This is colon, large bowel all through here. This is small bowel, and this is fat. So if there was a ring, it would be a metallic density, and all x-rays show is change in density. And so, of course, the more dense something is, the whiter it is. That's why the bone is white. And so there is no ring in there. Maybe y'all wouldn't be surprised what we found that we removed from animals, but I've removed batteries. I've removed, the main thing that we see is probably underwear. Cats and dogs seem to have a fetish for like the thong female underwear, which is sometimes kind of interesting when we remove it and pull it up and hold it, and I bag it, and just in case they want to use it again later or something. But yeah, it's funny, and the ones that tend to do it, it's like they're obsessed with it. So very rarely, honestly, do I have an animal where I remove something that I haven't had to go in and do something again later, not because of the surgery, but because they have this impetus to want to do that. It had a urinary tract infection, so what we did is we actually did a cystocentesis, we call it, which is where we actually stick a needle directly into the urinary bladder to get the urine. But as far as I know, that cat's doing really well right now with no Aggie ring and hopefully a clear bladder. The way I'm the happiest is if I get a case in and I work it up, I do labs, I do x-rays, and figure out what the problem is, and 2 weeks later the client calls me and tells me the animal's doing great. That's what makes me feel good. This is one of those professions that you can work yourself to death. Having an associate, especially like Dr. Etcher, where I can leave, has made my life great. One of the things that also made my life great was when Samantha, our 10-year-old, was born, we made the decision to close on Saturdays. and I'd found out that I had missed way too many youth activities of my kids because of being open on Saturday. Met Dr. Etch and interviewed her and found out a lot about her, and I'm very, very glad to have her here, and I really hope it's long term, because one of our things is I wanted somebody that I could transition this practice over to and get her in on ownership, and then hopefully at some point she'll own the practice and I will be working 1 or 2 days a week if she'd have me. But yeah, she's a phenomenal doctor and great with the clients, and I can leave and know she'll take great care of my clients.
Okay, my name is Dr. Cindy Echevarria. I work at Denton Veterinary Center. I'm a vet. So I'm a recent addition to this place. I started in March. I know it's privately owned by Dr. Winchie, and it does really well because everybody's super friendly and he's very compassionate for the animals. So I feel that it's a great place and environment to work in. It's strictly or mainly cats and dogs, and then an occasional rabbit. But I wanted to be a vet because I always liked the animals, particularly squirrels. And so since I would always see the squirrels around the house, I wanted a pet squirrel. And I couldn't have one because my mom was anti-squirrel, but we've always had pets in my house, dogs all the time. I had rabbits for interim, and like hamsters, you know, there's always some sort of creature. And when I saw my first dog kind of go through being sick and debilitated, it was really sad, so I thought it would be awesome if I could be one of those people that help in those scenarios. Yes, so that tooth came in for a facial abscess, and usually the 4th premolar, which is somewhat towards the back of the mouth, when the roots decay or there's a development of pus in that pocket, it causes an outpouching of the tissue forward, so you actually see like a puffy spot underneath the face. So I had to dig out all 3 roots, because if you leave it in dogs, it can lead to future problems. If owners do more maintenance type of dental care, like start them young, especially as puppies, but if you get them used to the brushing, you know, you don't have to deal with the hassle of, you know, wrestling with them, or where it gets to the point that they don't tolerate brushing at all, and then you have to deal with either like dental treats or dental bones to try to see if you can minimize how much tartar goes on there. I think information is probably one aspect. I think time management is also, because most people have jobs and, you know, are busy during the day, and they don't want to take, you know, to wrestle a dog to brush their teeth, even if they're the best behaved, is going to take at least like 10 to 15 minutes. So sometimes that allotment of time isn't going to work, even though even just a few times a week would benefit them.
Well, she's got that other tooth on the other side's fixing abscess too.
Oh, is it?
Look at it. It's just rotten. That's the only.
Is that the side that's swollen, or is
No.
it the other?
No.
I hear a lot, you know, I don't have time, I had to, you know, pick up the kids, they have soccer, or, you know, had a late meeting, like, you know, where they don't really have those extra 10 or 15 minutes.
So this is the 3 roots of the tooth that you wouldn't see. And this is the part of the tooth you do see. So the way it sits is like this in the socket, but you only see the tooth part right here, and this is all what's covered.
But there's plenty of substitutions. Something I particularly like a lot, Aquadent, which you put in their water, and it helps to delay plaque formation and give more of like a fresh breath. It's something they could do daily. You don't even have to, it's not hands-on really. You just kind of fill their bowl with it.
The single most rewarding moment was the day that we opened and had the Denton Chamber of Commerce here, and I cut the ribbon, because it's always been my goal and my life wish to have my own practice. And with a lot of help from my family, and especially financing from my dad and my wonderful grandmother, rest her soul, I was able to do that. But that was just opening and saying, I finally did it. And being able, 11 years later, to say, hey, I'm still here. Dr. Etch and I have 3,000 to 4,000 patients that come here on a regular basis that live 14 to 15 years, so somebody is dying every day.
You know, you just see them and it brightens your day, no matter really what's going on with the animal. And it's always good to see that same pet too, because I think they get bonded if they're here all the time.
We took an oath to take care of animals, and that's what we do.